Thank you everyone for turning up this evening. I got a document I wasn't going to share with anybody this afternoon from the NHS England, so naturally I'm going to share it with everybody. And it talks about BP at home. It talks about how the digital offer is revolutionising blood pressure management.
So we've been working with the BP at Home team for the last couple of years. We're supporting with some case studies at the moment about the onboarding of this app and how it can be spread and adopted to other PCNs. It's really exciting, really positive, and it's all about prevention for patients.
And there's now 2.1 million people on the platform nationally, with an aspiration at the end of March of 2.4 million. Now when you see our numbers a little bit later on, we're nowhere near that, but it says what the value is of this. And that document has got some links in it. And one of those links is to the work being done by the digital team in Dorset.
So remote monitoring, increase appointment times, significantly elevated blood pressure, flagged and treated in a timely manner. The Viso app will actually recommend a treatment plan in 80% of the cases. So then we know that these patients are on the right treatment. Reduced risk, and the risk that we talked about, if we reduce that blood pressure by 5 millimetres of mercury, the impact on reducing cardiovascular disease.
I think it's a great service. I mean, we've only just started using it ourselves, and we're just looking to see how other people have been implementing it. And I think it definitely will improve people's care, but it's just understanding how much capacity we need to provide for it to upscale it.
It's been really useful today to come along and understand the journey. I needed to know how it really works in practice, live, on the ground.
Okay, so we just started with BP at Home, and based on what we've done so far, the uptake has been good.
Our role is about getting innovation into healthcare, and we're really excited to hear more about this work and look at opportunities where we can spread this across both Dorset and wider as part of our network.
More and more patients are ready and wanting to take control of their own health.
We've got 68% of our patients are using the NHS app, so I know those patients are digitally enabled in primary care, so how then do we catch those people to hopefully use this app?
Patient education or some sort of campaign to really stress how important this is, not just for the patient but also for the healthcare system itself. I think that's very important so people understand that message properly.
And finally, we have our Outstanding Contribution Award. So please give a huge round of applause for Louise Bell.
It's nice to see so many people doing the same thing and getting to see Louise, who has about 500 people on it, and learning things from her. It's been a good takeaway for me.